Hello and welcome to this week's What Were They Thinking? As has been standard for the last few weeks, we begin with the COVID-19. This newest version of SARS is now spreading faster outside China than it has been within. This is amazing given the population density of other countries is substantially lower than that of China. But in Europe and Latin America, there are more infections occurring than what there are within China. This may owe to a number of factors, not the least of which is a far less totalitarian approach to curtailing people's freedom, and as a result, the spread of the disease. This is especially true in northern Italy, which is considered one of Europe's hotspots. A place in which the virus is not only established but spreading at a very disconcerting pace. This increasing spread to the COVID-19 has led many other countries to begin issuing travel advisories, the gist of which is do not go to Italy. Others have also said do not travel to China and other regions in which COVID-19 has become endemic. These are, more appropriately, stern warnings rather than restrictions preventing you from traveling to these places. The upside to going on a holiday to one of these countries would be that after 14 days there, you could return home to another 28 days of relaxation whilst in quarantine. The spreading COVID-19 is a concern for just about every country that either has reported cases or anticipates reported cases. This is why the CDC has been trying to model how it would spread, and in fact, it's a rising concern for them now that they have multiple confirmed cases. They've been examining how exactly the COVID-19 would move throughout the country and who it would affect, given they already have 60 patients confirmed to have the coronavirus, and the majority of these came from one place, a cruise ship. They have, in no uncertain terms, stated that if the virus were to start spreading from person to person in a way that is similar to China, the healthcare system would become overwhelmed and overloaded, with elevated rates of hospitalization and increasing rates of death. Public places would be emptied, and people would be best served by simply staying at home to avoid any possibility of being infected, or, in the best possible case, simply exposed, thereby exposing others. This is, of course, a prediction on what would happen, and we don't know how accurate it will be. With any luck, it will never get to that point, but most departments, states, and services are taking a more cynical view and are preparing for that likely eventuality, some going so far as to have declared a state of health emergency. One upside to all of this news is that the coronavirus has substantially affected the other coronavirus, the one everybody calls a beer. Sales are down nearly 40% as Americans won't buy it, finding some association between the names. This delightful piece of news comes out of a study published recently which finds people are finding the name association disconcerting. Numbers break down along these lines. 38% would not buy Corona under any circumstances. 4% said they would continue drinking it. 14% they would not order it in a public venue. And 16% were confused about whether or not it was related to the coronavirus. That misconception might be why there has been an increase in searches for corona beer virus over the last few weeks. Only in America would a gift like this keep on giving in such an unexpected way. In other alcohol but not virus-related news, a case study was published with the first known instance of a person who urinates alcohol. The American woman has an unusual and unique condition wherein her bladder contains enough yeast to ferment the urine, thereby turning it into alcohol. The researchers have proposed to name this bladder fermentation syndrome or urinary auto-brewery syndrome. It is similar to other conditions like auto-brewery syndrome, in which consumed carbohydrates are converted into alcohol in the GI tract. This allows an individual to become intoxicated even when not consuming alcohol via regular means. This case study is interesting as it involved a 61-year-old woman who has both liver damage and poorly controlled diabetes. This is one of the reasons why she was involved with the University of Pittsburgh Medical Center. She has been waiting for a liver transplant, and doctors suspected she was having problems due to alcohol addiction. They repeatedly tested her urine for alcohol, which came up positive. This would normally mean that they were not eligible to receive a liver, but that raised more questions if she was not consuming alcohol. The easiest way to know whether or not someone is simply lying about consuming alcohol is to test their urine and their blood, and that's what they did. What they found was a lack of alcohol in her blood, but there was alcohol in her urine, and it is very hard for it to get in there anywhere else that would not be found in both. Either this sample would be contaminated, or somehow or other, alcohol was getting into the urine sample but not her blood. This is what led to the mystery of where the alcohol came from. There was too much for it to be a contaminant, but it wasn't in her blood. This led to the question of what else was going on. Being a diabetic, there was a surprising amount of sugar in her urine. As we know, sugar and yeast leads to alcohol. The doctors involved in this were able to put one and one together and figure out there had to be yeast somewhere in her urinary tract. In this case, all the way back in her bladder, that was fermenting the sugar that was in abundance in her urine and turning it into alcohol. Antifungal treatment was not successful, and it is thought that at least this was in part due to her poorly controlled diabetes. Because she wasn't consuming alcohol, and that this was, in other words, a freak accident, she remained eligible for a liver transplant, but the case study doesn't provide any details on what happened. Next is another case study, and one that is interesting. It regards a woman who drastically took more LSD than is considered normal in any given dose. The 46-year-old woman took 550 times the normal dose of LSD after having mistaken it for another drug. She snorted a 55 mg dose of the pure drug in powder form, believing it to be cocaine. The rough timeline after this was 12 hours of vomiting, intoxication, and having blacked out. Then another 12 hours of relative high, but still being ill. 10 hours after that, they were able to converse and function with relative ease, primarily being able to get to the bathroom to complete anything that followed from their overdose. They came out of it relatively well. In another piece of news that didn't end so well, the infamous flat earther and self-proclaimed rocket man, Mad Mike Hughes, died after his homemade rocket crashed in California. The man was an avid believer that the world is flat, and had built his own, fundamentally steam-powered rocket in an effort to reach a height where he could see for himself and prove the world really was flat. His death occurred following an attempt to launch his rocket. The process of the crash was horrific and, according to reports, horrifying for the audience that was there. There has now been claims made that the flat earth theory was all part of a PR stunt in order to drum up support and funding for it. This is an interesting case to be made given the history of interesting theories put forward by him, but his death is a sound lesson in how to and how not to prove things, and primarily the wariness that you should have in trying to do anything that requires that level of technical knowledge, unless you are A, an expert, B, conducting it with the appropriate preparations, and C, in a situation where you won't be harmed if something goes wrong. In a final piece of space-related news, scientists have found protein in a meteorite. This in and of itself is not all that spectacular. We know full well that small molecules will gradually build up to more and more complex structures, protein being relatively complex in and of itself. What we didn't have until now was an actual sample that could be found having come from space with actual protein in it that we could say, here is evidence of this in action. The preprint of the article is a very interesting read, and it does provide a lot of proof of existing arguments, theories, and research that's been done in a lab. Perhaps the big one is that early life on Earth could have been initiated by celestial bombardment with meteorites that had protein in them. This could have kick-started or exacerbated processes that were already in effect on Earth. This, in combination with primordial soup, could have quite easily begun life as we know it. Thank you for watching this video. If you found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions below.